roll out on Monday. Now, this phase we know is for those above 60 years of age and those above 45 years with comorbidities. Of course, the government has specified the list of comorbidities. But what we've seen in the past few weeks has been a degree of hesitancy towards the vaccine, has been a degree of uncertainty towards the vaccine, and that is what the government needs to address if it wants to ensure large-scale, in fact, mass vaccination of COVID-19. In this phase, how has been the response since yesterday, and how is the government planning to tackle this hesitancy? Can it tackle this hesitancy? Himani Chandna, who, as you know, tracks health for ThePrint, is with us. She will answer your questions in government matters. So Himani, let's talk about the figures from yesterday. What kind of response did the second phase see? Because we also saw people register on the CoWIN website to get the vaccine.
Yeah. So, Ruhi, yesterday, 1,28,000 beneficiaries above 60 years have got the shot, whereas 18,800 beneficiaries who are above the age of 45 years with the comorbidities, they have got the shot. This is according to the statement by Health Ministry yesterday evening.
Okay.
So these are the numbers.
So how do you make sense of these numbers? Is it good enough? Is this, do you think the pace seems positive enough?
Right now, I'll say the pace seems positive enough, and I'm sure that with more time, this will even pick up further. Considering Prime Minister Modi himself has taken the shot, and today even Harshvardhan and his wife and other ministers have come forward to take the shot. So I think that this is going to, suppress a bit of the hesitancy, and I think people will be more excited to take the shots going forward.
So Himani, as you rightly pointed out, Prime Minister Modi did take the shot early yesterday. In fact, he took the co-vaccine, which is also a way of building confidence among voters, among people, to be able to, sort of go and take the vaccine, not have that doubt in their minds. But what else is the government planning to do to build confidence? Because clearly there is a need to address that hesitancy that has been seen.
So I will start with the co-vaccine point, because co-vaccine was launched and it stirred a lot of controversy because the efficacy data was not present at that time. So as far as we talk to the government officials, we understand that they show greater intent to put the efficacy data once it's available in the public domain. Because that vaccine is built on a very traditional platform, and it has been used in several vaccines which we have taken since years. So I think that when that data will be available in the public domain, all the stories of hesitancy that we have read related to co-vaccine will be addressed.
Okay.
Otherwise prevailing vaccine hesitancy, for that we in fact did a story that state governments on their own have been trying to reduce the hesitancy by promoting the vaccine and the people who have taken the shots, by endorsing them, by advertising and making them endorsers and all of that. And I'm also told that not in the urban areas, but the government is also trying to mobilize people via ASHA workers and Panchayati Raj, and all these
so grassroots
community, through the community programs. And I'm also hearing that resident welfare associations are also likely to be included in the program.
Right. So Himani, let's talk a little bit about in terms of the supply of vaccines. Is there a shortage? Is that a smooth process so far? Because now it's opened up to earlier the first phase was for frontline workers and health workers. That was different. Now it has been opened up to people, of course, with certain restrictions. So what is the supply situation?
Ruhi, supply is not suppressed as we understand, because stocks are available. So much stocks are available, so that we are worrying that they should not get expired.
Right.
Because some of the stocks that Serum Institute of India for Covishield had produced have the expiry of April. So there is no problem in the stocks and the stockpiling. The issue could be in the transportation of vaccines to a particular state.
So the supply chain could be a problem.
Supply chain could be a problem.
Right.
So as far as we are understanding from the states, so this is the logistics is the only issue as of now. There is enough vaccine available in the country. That's what I can say right now.
All right. Okay. So before we start taking viewer questions, I would like to tell our viewers that, you know, a lot has been talked about Covaxin and Covishield, but we often don't know the real difference in terms of the technical difference or the medical difference between the two. So you can log on to our YouTube channel or our Instagram channel to watch Today I Learned with ThePrint, which is our daily feature in which we've explained the difference between the two in one snappy minute, and that's something that's useful. It was useful for me to know as well.
It's very useful.
Right.
It's very useful. But you will not get the option to choose your vaccine.
Right. Actually, that's a good point that you've made, Himani, because there is some amount of confusion there as well. Are people getting to choose what vaccine? Are they being told what vaccine has been given to them?
So, yeah, they can get to know that which vaccine shot they have got, but they cannot deny or they cannot ask for a specific vaccine to be given. It's completely a random system.
Okay. All right. Mohak Elani, why isn't the government outsourcing the development of the CoWIN app?
So, I am not sure why government is outsourcing the development of CoWIN app, but they have involved, Mr. Sharma is behind the making of CoWIN, and I don't think that, because the app which has to control that kind of a mega drive,
right?
It may take some time. We are a country of over a billion people. So the app that is showing glitches could be normal, and I don't think that it could be linked that to outsourcing and all of that.
Right. In fact, perhaps, Himani, it's also something that the government would like to control because it's also information.
It's a central database system, and when it will be easy for the government to spot any trend that is happening. So I think centralization of data is very important at this point of time.
In fact, as Himani mentioned, Mr. R.S. Sharma is in charge of the CoWIN app. He was, of course, former TRI chairman. I did an interview with him a couple of weeks ago on the app, in fact 2-3 weeks ago, so that's available on our YouTube channel for you to watch. Okay, this question is from Pramod Ravikant. This seems to be directed at me. When will Sonia Gandhi take the vaccine? I have no clue. I have no insights to offer into that, but she is certainly eligible in terms of the criteria. So anytime in this phase, she is eligible to take the vaccine completely. There's another question from Pramod Ravikant. Which countries are next in line to receive vaccines from India?
So I think Brazil has just signed the deal with Bharat Biotech for Covaxin. So I think Brazil would be the next one as per the announcements.
Right. So Himani, this is something that I have asked in earlier episodes of Government Matters as well. But there is a concern around India sending vaccine, exporting vaccine to other countries when our population hasn't been vaccinated entirely. But you say that there is no shortage, so that's not a concern.
Yeah, and we also have to consider, like in the last episode also I mentioned this, that when we are gifting or granting the vaccines to the other country, we should consider a point that when even one person is not safe against COVID, no one is safe against COVID.
Right.
So we have to consider that point. If a country remains non-COVID free, it is eventually going to come to our country anytime soon.
Correct. So nobody is safe till everybody is safe.
Right.
Okay. Rajat Sharma, how can state government takes initiative to reduce vaccine hesitancy? So you've talked about the central government, but state governments also have a role to play in this.
Definitely. State governments have a bigger role, in fact, I would say, because in past we have seen center issuing the advisory to tackle vaccine hesitancy. They have been writing letters to the states, they have been sending the officials from the center to do the hand holding and understand that what are the problems they are facing, but state governments have a bigger role in this to play. In fact, they have to spot the trend that why healthcare workers or the other people are not coming forward, and they have been doing this since the vaccination drive has kicked in. In fact, we did a story that there were 12-13 states which had the vaccination, which have achieved less than 30% of the vaccination targets. We in fact managed to speak to the 8-9 states out of them, and we got to understand the various issues. Some issues were related to the terrain and the logistics.
Right.
The other issues were related to the hesitancy part only, where people wanted to wait and watch, where people wanted to Covaxin data to come out, or there was a general general feeling that this person has taken the shot, let's observe him, and if in case he's fine for the next 10 days, then I will come for the appointment. So all these but vaccine hesitancy was the major thing why states were unable to achieve the targets. And like I told you earlier also, that they chose the brand ambassadors. For instance, some reputed doctors who have taken the shots, they were using them, advertising their videos on the social media channels. They were making some WhatsApp groups reminding people for the next date of the shot and all of that. So state governments are quite involved in that.
So Himani, I did want to ask you this, this cap of 250 rupees per shot. What are the private hospitals saying about it? Is it too less or is it sustainable?
So private hospitals have no say in that because private hospitals had earlier asked for only rupees 100 administration fees, which they are getting.
Okay.
So so in negotiation part, hospitals are fine with it. Companies who are giving the vaccines, the vaccine manufacturers are not happy with the price.
Okay.
So, but government has put the ceiling.
But what, according to them, on an estimate, would be the right way to price it?
So they were okay with rupees 300 price.
Okay.
So this has made one shot cost rupees 400, 300 vaccine charge plus 100 the administration charge for hospital. This is what at least I know Serum Institute of India, according to sources, were fine with 300 rupees pricing. But now they are getting just rupees 150, half of what they had asked for.
Right.
So the companies, I understand that, are not happy.
Okay.
But as I told you, they have a lot of stockpiling. Some of their stock will expire in April, May. So I think this is the reason they have succumbed to the pressure.
Okay. There's a question from Rahul on whether India will fall short of COVID vaccines. Himani's already answered that with quite a resounding no. Kaushik Dinak, why haven't we seen a big jump in the number of people being vaccinated yesterday? So should it have been more? I asked you earlier as well.
Of course. We are a country of 1 billion people, so of course the number can be much higher than what we have achieved. But it's okay if we start with a small number, considering we all know that this is a new vaccine. So, but I have also seen one thing, that a lot of people are calling us, even lot of people are involved in making the list. Lot of people are eager to book appointments for their parents.
Right.
Lot of people I have seen personally who are eager to get the appointment for their grandparents also. In fact, I tried on the app this morning, but I faced some OTP issues.
Right. That's happening is what I hear.
So I think that excitement is there. But of course, because this is a new vaccine, this was very much expected, and not just in India but across the globe.
Right. So also, Himani, just for the benefit of our viewers, if you could explain what is the timeline. So you take one dose, then you take a second dose, and then how long before the immunity kicks in?
So once you have taken the first dose, your next dose will be due after 29th day, on the 29th day. But even if you miss the 29th day, you can take it anywhere between 29th to 42nd day. So this, Ruhi, we are not sure that how long immunity will be in our body. Because for Pfizer vaccine, some studies have said that 3 to 6 months the immunity will be in our body, but we are not sure. Some studies in fact have said that it will be forever. So we are not yet sure about it, because these studies will take time, and I'm sure these all are happening in the background.
Okay. This handle called Lightning Emperor wanted to know why we are giving vaccines to other countries before ourselves. You again answered that. This is a handle called YL. I don't know how the full form. How much time do you think it would take to vaccinate majority of cities and large villages? So if you were to give an estimate, or if the experts are giving an estimate, how long would it take to vaccinate a substantial number of people, enough for us to develop herd immunity of some sort?
So again, we are not sure that for COVID, what would be the percentage to achieve the herd immunity? Experts say that it will be anywhere between 60% to 80%. So it means that 60 to 80% of the population of India needs to be covered. So I think there needs to be some mathematical calculation that how much number we have achieved since 16th of January when the drive kicked in till now. And going forward, because we understand that government plans to vaccinate around 50 to 70 lakh people every day.
Right.
So going by that number, I think we will be able to achieve the herd immunity by an year or so.
Okay.
So, but I think this needs mathematical calculation, and experts should answer this.
Right. Also, this is, we should always remember that just because you've taken the vaccine does not mean you can stop wearing your masks or hand sanitizing can be given up. This is basic hygiene now, which has to be maintained.
COVID appropriate behavior has to be followed.
Right. Okay, this is a question from Ramesh Kumar. How safe are India's COVID vaccines? Is there any evidence that suggests COVID vaccines lead to death? So this is the kind of hesitancy we are trying to address, the government is trying to address.
So according to the data, the adverse events following immunization, which in short we can call side effects of the vaccine, are much less than 0.01%. So there is certainly no cause of concern. The only thing is that whatever the mild reactions like getting fever, getting rashes, getting swelling, redness in the area, itchiness, all these are very common. And in fact, when we take our kids to get the immunization,
same thing happens.
Infants and kids also get all these side effects. But the larger side effects, reporting of deaths, cardiac arrest, and all those kind of allergic reactions, they should be taken care of, and all this should be carefully monitored and investigated. That is what I have understood from the experts, that right now the AFEs, the adverse events that are being reported, are not of any concern.
So they're not severe at all. They are
not at all.
They are normal side effects that you see from any vaccination that you take.
Right.
Okay, Preeti Chaturvedi, is there a bias towards a particular vaccine in India?
I don't think there is any bias, because we have approved 2 vaccines and I think both are doing well.
Right.
Just that one vaccine was in the phase 3 trial and it doesn't have the efficacy data.
Yeah.
So I think that, but the numbers of the production of that vaccine and availability across India is very less.
Okay.
Covishield in majority is with most of the states. So I don't think that there is any bias.
Right. Okay. This is from a handle called UFO_believer. Should priority be given to states like Maharashtra and Kerala? So this is a valid point, because there are 5-6 states which are witnessing this spike or so-called second wave. Should there be priority given to these states?
I'm sure, because stock distribution of vaccines will be taken care according to the number of cases and all of that, and according to the supplies. But I think that according to the government's notification, people who are actively having a COVID or those kind of symptoms cannot be given the vaccine till the 3 or 4 weeks.
Okay.
So they have to wait for that. So I think the areas where majority of people, the active cases are more, I think they cannot be given the vaccine till some period.
Right. Okay, so we have some questions left. Maybe let's take this last question. This is from Sen Baga Muthu Rahul. How is the government addressing the glitch issues in COVID? So it's as you mentioned, and this is something Mr. Sharma had also said in his interview to me, that teething problems will happen. But is it of concern to the government? Is the government concerned about it?
First of all, I would like to clarify one thing which Health Ministry had clarified yesterday, that people were reporting glitches in the CoWIN app.
Right.
We are not supposed to use the
Correct.
app. App is only for the administrators. If you are looking at registering yourself, your parents or anyone else, you can go to www.cowin.gov.in.
So the website, not the app.
Portal.
Right.
Yes. So CoWIN glitches, if in case, we will not face the CoWIN glitches if we are going to some center and center is taking, a long time to process your request. There CoWIN glitches could happen, and as I just told you, because this is a software and the the crowd could be a bit more, so that, software could handle all the load. So we can, call them teething problems, and these hiccups were bound to come.
All right. Okay. Thank you, Himani, for helping us understand how the second phase of COVID vaccination has gone so far, and really what lies ahead and how the government is planning to address the hesitancy that we've seen. Thank you so much for sending in your questions for Government Matters. Keep subscribing to our YouTube channel.